Paul. My name is student Dr. Koch. How
Hi.
are you doing today?
Good, good. Nice to meet you.
So what brings you into the office?
So, Dr. Koch, I've been really concerned about the way my nails look. It looks really funky. Mostly my big toenails, and sometimes I experience a little pain when I walk or when I go for a run.
Mm-hmm.
Yeah.
Can you tell me a little bit about what happened?
So I've been going to the nail salon for the past couple months, and I think that has to do something with it because I usually take good care of my feet, and it's the color, the discoloration really freaked me out. So that's why I'm here with you.
All right. And can you point to where you are experiencing the pain?
I would say right here, around the big nail, big toe.
All right.
nail
So
region.
right the big toes. And is this pain constant? Does it come and go?
I wouldn't say it's constant. It's mostly I experience it when I go for a run or when I go for a walk. Or when I actually press on it, it starts hurting. So I'd say mostly the pressure that causes the pain.
Okay. And is it like a tingling, a sharp feeling, or just pressure?
It's just the pressure. Yeah. When I just press on it, it just hurts.
Have you tried anything to make the pain better?
No. I just wash it and then regularly dry my feet. Nothing has really helped.
And when you walk and have like a tight shoe on, that's the only time you're experiencing pain, right?
Yes. Yeah.
Okay. And is this pain only in the toes, or sometimes does it creep up your leg or to other?
I think it just stays. It just stays where it is. Yeah. It's mostly stays at big toe.
And on a scale of 1 to 10, 10 being the worst pain, 1 nothing at all, how would you describe your pain?
I give it a 4 out of 10 when I go for a walk or when I just put pressure on it.
All right. So I'm just going to ask you a series of questions to get an understanding of your past medical history. Have you ever been hospitalized?
No.
Any illnesses in the past or as a child?
No.
Okay. Are you up to date with your immunizations?
Yes.
Vaccines included?
Yes.
Great. Are you on any medications?
No.
Are you allergic to anything?
No.
Have you had transfusions in the past?
No.
Would you be able to state the date today?
Yes. Today is April 16th.
All right, great. So now I'm just going to get your social history. How would you describe your sleeping patterns?
I usually get 6 to 8 hours a night.
Good. Do you smoke?
No.
Are you sexually active?
No.
Do you currently work?
I'm a student. I'm a full-time student
Great, where at?
at FIU.
Very nice. And how often do you exercise?
About 3 to 4 times a week.
How would you describe your diet?
It could be better.
Do you drink?
No.
Do you use recreational drugs?
No.
Are you married?
No. Same.
Do you have any pets at home?
I have a turtle.
What's his name?
Jeff.
Nice. And have you traveled recently?
No.
Okay. And your family, alive or dead, have they had a history of diabetes, hypertension, cancer?
No, not that I know of.
All right. So now we're going to move on to the physical examination. So the first thing I'm going to have you do is prop up both of your legs here,
Okay.
and I am going to check your pulses. So the first pulse I'm going to check is your Grisell's pedis. It's palpable 2 out of 4. I'm going to check your posterior tibial. 2 out of 4. And also, I'm going to just raise your leg a little up and check your popliteal. 2 out of 4. And as well as this one. Tougher. Great. So I'm just going to pinch your skin to see the elasticity of it, to see if you are hydrated, which you are. The skin turgor is good. I'm just going to run the back of my hands on your leg up to your toes. So the skin temperature is warm to warm. And I see that you do have hair present on your legs as well as your big toes. So you have good circulation. And I'm going to press on your toes now. Check the calculated fill time. And they are all under 3 seconds. So now I'm going to evaluate in between your toes, see if there's any macerations or abnormalities, which you do not see. I'm also going to see your toenails. So I see that your big toes in particular, they are thickened, they're a little brittle in appearance, and I noticed that it is the yellow color that's very prominent on them.
Let's see.
Other than that, the rest of your toes look great. So now I'm gonna check the bottom of your foot. Looks good, as well as your leg. Okay. Alright, looks good as well. And based on the plantar surface as well as the dorsal surface, you don't have any lacerations, scabs, everything looks clean, and no bruising. So now we are going to move on to your musculoskeletal examination. So I'm just going to check your muscle strength. So I'm going to push inward, and I'm going to have you do the opposite of what I'm performing. So I'm pushing in, you push out.
Okay.
Great. I'm pushing out, you push in. I'm pushing down, you push up. I'm pushing up, you push down. Excellent. So all your reflexes are strong. Now I'm going to check the range of motion of your first ray. Just present. And check the metatarsal. It's present. Check your subtalar joint. Present. And now your ankle joint. So you have full range of motion. Next I'm going to take your foot, put it in neutral, and press. Great, and now I'm going to bend your leg a little bit like so. Your foot in neutral, bend. Great. Perform the same thing. Your foot in neutral. Excellent. Neutral. Great, so there is no diminished angles there, and there's no orthopedic abnormalities from what I observed. Next I'm going to do the neurological portion of the exam. This is the Siemens-Weinstein. You're going to feel a little poke. So I'm going to have you close your eyes, and I'm going to tap in 10 areas. So when you feel a tap, please say yes.
Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes.
Excellent. Now I'm going to do a sharp and dull test. So this is going to be with your eyes closed as well. This is how a dull feels, and this is how a sharp feels.
Okay.
So I'm going to have you close your eyes again, and you're going to tell me if it's sharp or dull.
Sure.
Ready?
Sharp. Dull. Sharp. Dull.
Excellent. And now, as well with your eyes closed, I'm going to touch a toe. You're going to tell me which toe it is, and if I'm moving it down or up.
Sure.
Ready?
Right big toe down. Right little toe up. Left little toe down. Left big toe up.
Great. And you can open your eyes. This is a tuning fork, so I'm going to have this tapped. I'm going to place it on your bone. You're going to feel a vibration. Once you feel it stop, please say stop.
Sure.
And when you feel it, please say yes. All right, so will you please close your eyes?
Yes. Stop. Yes. Stop. Yes. Stop. Yes. Stop.
Excellent. And now I'm going to take this instrument here, and I'm just going to brush it on the bottom of your foot. Ready?
Okay.
Okay. And I'm going to place your feet down. I'm going to tap your patellar. Excellent. Great, so all reflexes are present. And this concludes the whole examination. So from what I'm seeing, based on my observations, is that you have onychomycosis, and what that is a nail fungus, right? And it just so happened that at the nail salon that you go to often, they didn't sterilize the equipment in the area well enough, so that's how you got it there. Your toenail is yellow, discolored. It's been there for a few months. I see your nail is brittle and also thickened. and when I had the nail, it had a little odor to it, and so everything leads me to believe that this is onychomycosis. I don't believe that it is psoriasis because there's no skin lesions like scaly plaques, and I don't believe that it's dermatitis, chronic dermatitis, because the skin is not red and it's also not dry, and your main problem is in the foot, particularly in the toenails. So what I'm going to do is prescribe you Julia. You're going to apply it once a day to your nails directly, and this is going to be applied for 48 weeks. I'm going to have you come in for a 4-month follow-up to see how you're doing, see if it is effective. And Julia, it just comes in a small 4 milliliter bottle. Other than that, it should go away. The results vary for each person. So other than that, we're done here. Do you have any questions for me?
No, thank you very much.
Alrighty, thank you very much, Paul, and I will see you in 4 months.
Thank you.